I thought that I would give a little update of where I am post surgery. I'm exactly 15 days since my elbow surgery. It's brutal. So it was to remove all of the hardware. And I'm so happy because today I was able to get all of the staples out and the soft cast off. So I have way, way, way less bulk. And I have this really cool robot arm hinged brace. So happy to be able to have my arm breathe and hang at my side. I will still use like the sling attachment for this. Right now, I feel really good. We'll see what happens come nighttime. The part that is really throwing me for a loop is the nerve pain, something that I did not really plan for. This was supposed to be a routine hour-long hardware removal situation. Like get in, get out, unscrew it, you're just healing the bone and the perforations. Unfortunately, wasn't that straightforward. Instead of it being an hour and a half long surgery, it ended up being like 4-ish hours. They did get all the plates and the pins out. They were not able to take all of the screws out because specifically said that my bone density had increased because I was working out and lifting weights, which is a good thing. They had to drill around some of the screws. Bone had grown over 3.5 screws left in there. Too high of a risk to remove all of them. They were able to shave them off so they're not protruding. As long as they don't feel them, that's the big part. The other thing that I learned, totally gross, which is totally gross, and if I think about it too much, it makes me want to gag, is that for some of the screws, they had to drill around it in order to take it out. It wasn't just a clean thread pull. So they drilled around it so the holes are a little bit bigger. Some grafting, kind of like Bondo. So crushed up bones, like, I don't even, crushed up bones to fill the hole. It's so gross because I went, so does that mean I have dead man's bones in my body? And the answer is yes. The thing that really sucks is that during surgery, the decision was made to transpose or relocate my ulnar nerve, which is pretty much like your funny bone nerve that runs right on your elbow, because there was so much scar tissue. Move my nerve completely, just over a little bit. And that's the source of pretty much all of my pain at this point. The ulnar nerve is like what your pinky and your ring finger are connected to. So right now it's like very, very limited. So I really just had the works done, but I'm on the other side. I'm on the up and up. I have the go ahead to start physical therapy. I'm not going to be able to lift anything more than 3 to 5 pounds for at least 3 months. Can't do any high impact exercise. I can't type. The nerve part of it all is going to take a little bit longer than the bone healing, which was what originally I had planned for. So all good. Keeping myself positive. That's where I'm at right now. I feel a million times better than I did yesterday. So I feel really fortunate to be able to have taken all of that stuff off. If you have any experience or any tips for recovery or nerve pain or anything, please let me know. I am all ears. I will take anything that I can get. If you relate, or if you are caring for someone in this position, or if you are going to be having something similar in the future, the only thing that I would say is do your research and ask questions and advocate for yourself. That, I would say, that's the biggest thing. I had to ask about like this brace, like this wasn't planned. I called during off hours to get more medication. I had to refill my pain meds, twice, and it's not awesome. So just really make sure you know what you're getting into, and things happen. Even though I went into this feeling like I had a really good idea of what to expect and getting my mind right, I am still kind of trying to wrap my head around the other parts of it. The nerve relocation, the fact that there still is hardware in my body, and now dead man's bones. So, yes, appreciate all your support and kind words, and more to come. See you later.